Hi, my name is Lucy Potter. I'm an MPH candidate at UTHealth School of Public Health. Today, I will be presenting my practicum project, which is the health behaviors of the caregivers of pancreas-kidney transplant recipient patients. So, as a background first, transplant caregivers are extremely important to the recovery of their loved ones, especially with all sorts of transplants. However, little is known about the quality of life of these caregivers, especially when it comes to patients who have received dual pancreas-kidney transplants, also known as SPKs. In general, caregivers prioritize the needs of their loved ones, and this results in a lot of serious issues such as burnout, fatigue, and depression. So therefore, the purpose of our study is to realize and investigate the quality of life of our caregivers of SPK patients and look at the psychological impact that caregiving has. So in order to examine these quality of life measures, we used a well-validated survey instrument called the Health Promoting Lifestyle Profile 2, also known as HPLP2. This is a 52-question instrument that is scored on a 4-point Likert scale with higher scores, meaning higher quality of life. These surveys are self-reported measurements and were administered at the time of clinic visits of patients and their loved ones. And so afterward, all caregivers were given a list of mental health resources and wellness resources so that maybe they could help improve their quality of life as well. The categories that the HPLP2 measures are health responsibility, physical activities, nutrition, spirituality, interpersonal relations, and stress management. After all data was collected, it was analyzed using R. Results showed that we had 22 participants who were enrolled. The mean amount of time that the patients had post-op when the caregivers received the surveys were about 4.5 years. The range of time, however, of these patients post-operatively range from 1 week to 20 years, actually. We can see here the overall levels of quality of life of these caregivers. The highest measurements were specifically in spirituality and interpersonal relations. When we stratified the data based on patient operation time, meaning patients who had received their surgeries prior to 1 year ago versus patients who had received their surgeries more than 1 year ago, we can see that there is a difference in the quality of life of caregivers. Namely, especially in all categories, the quality of life post 1 year in operative time decreased compared to less than 1 year post-operative time. These were especially pronounced in the categories of health responsibility, nutrition, spirituality, and stress management. So therefore, we wanted to see what's going on. In general, all caregivers reported low levels of physical activity and nutrition. This is very reflective of the United States population in general, with high levels of obesity and low physical activity. And so as a result, we want to look at what's going on. And the main reason perhaps is because as the length of time of caregiving increases, the toll of caregiving also increases for caregivers, especially in health responsibility, nutrition, spirituality, and stress management. So the next step is to evaluate, how can we do this? How can we improve these categories? How can we make protocols so that we can improve the lives of our caregivers? This is what we want to look at for the future. Thank you very much. I know that we can't see the acknowledgments, but thank you to my mentors, everyone at the Houston Methodist Hospital where this was conducted. Thank you very much. Bye-bye.